Dear learners and viewers, welcome to this module of MEV 002 Environmental and Occupational Hazards. So here we will discuss on biological warfare and bioterrorism. I introduce myself as Dr. Sushmita Bhaskar, working in the discipline of Environmental Studies at the School of Interdisciplinary and Transdisciplinary Studies, Indira Gandhi National Open University, New Delhi. Let us now see the learning objectives of this module. So after listening and reading to this module, you will be able to discuss and define the terms bioterrorism, what biowarfare means, what are the causes for the same, and how we can control and also mitigate the same. Now, by definition, if we have to go, biological disasters may be devastating effects that may be caused by biological agents or their toxic products. It can kill or incapacitate people, livestock and plants. So sickness and disease, these are important subjects that have exercised the human beings throughout the dawn of civilization. And some diseases have affected crops, they have spread from the affected crops to the human beings, and also the diseases have also affected the livestock and the animals, and from the animals and the livestock also it has affected the well-being of human societies, and that way it has become more complex as the populations have increased. Now, biological hazards, these are as harmful as the physical as well as the chemical hazards, and most of these are caused by the biological agents which are tiny and microscopic in nature. They may not be visible to the human eyes. For example, bacteria and viruses come under that category, and along with plants and animals, they also cause mild to severe disease in the human beings. Now, unlike the physical and the chemical hazard, the biological hazards are given less attention, and they often cause huge socio-economic problems and losses. But the effects of the biohazardous agents are slight and slow in the initial stages, but then the risk increases when the causative agents are actually left unattended. The diseases that have caused the largest disruption, that was in the very early times, that was plague, then the low-borne typhus, smallpox, because of their high mortality. Right now, like smallpox has been eradicated by the use of certain proper vaccines, and there are other targets also which the government is focusing on as to the like eradicating tuberculosis, which is also eradicated in our country, then the eradication of polio. Polio is also eradicated in our country. So there are some other targets also that the country and other nations are also working and striving for, where these disease and infectious diseases can be controlled and totally eradicated by the use of certain proper vaccines. So disasters have occurred when the environmental factors were conducive for their proliferation and growth. For example, Black Death. This occurred when the conditions were favorable for the increase in the number of rats. Post World War I, the movement of population led to the spread of the Spanish influenza virus. Now, talking about the Black Death, most devastating pandemic that occurred in the human history was the Black Death, and it resulted in more than 75 to 200 million deaths in the Eurasia, and it peaked in Europe in the years 1346 to 1353. You can see how many years that had remained. And then there were several competing theories, as they say that when the DNA of the people were analyzed in the northern and southern Europe, they indicate that the pathogen responsible was Yersinia pestis, the bacterium that caused the same, and it resulted in several forms of plague, including the bubonic plague. So where did this originate from? It originated in the arid plains of Central Asia, and then it travelled along the Silk Road. It reached Crimea by 1343. From there, it was likely carried by the oriental rat fleas living on the black rats that were regular passengers on the merchant ships. So that is why we say that cleanliness and cleaning of every place is very important. Spreading throughout the Mediterranean and the Europe, the Black Death estimated to have killed almost 30 to 60% of Europe's total population. So that was a very big percentage that were affected, and the population was drastically reduced. So it reduced the world population very less in the 14th century, and this was some lesson that had to be learnt by the human beings. In the same way, Spanish flu, or La Grippe as it is called, this influenza pandemic, it ranged from 1918 to 1920, and it killed more than people than in the Great War, and today this is known as the World War I, when somewhere between 20 to 40 million people were affected. And this was also the most devastating epidemic that was recorded in the world history. and more people died of influenza, that is this influenza, in a single year rather than the Black Death or the bubonic plague, and it was a global disaster. And some researchers suggest that the specific variant of the virus had an unusually aggressive nature. Now coming on to the history of bioterrorism. So during the World War I, the commanders tried to use the knowledge of infectious diseases to influence their military tactics. And until the development of bacteriology and vaccinology, it was not possible for infectious agents to be used in these situations. So bioterrorism can be defined as the use of biological agents to cause death, disability or damage mainly to the human beings. The three basic groups of bioterrorism and the biological agents that could be used as the weapons in bioterrorism, they are bacteria, viruses and also the toxins of these agents. Now the biological agents can be dispersed easily into the air by spraying them, nobody would even know, they would not be even noticed. And the main problem is that you cannot smell a bioagent, you cannot see the agent, you cannot hear the agent, and you cannot even feel the agent. So how it is being dispersed and how herds or the animals or the people are being affected, it takes time for people to realize that there is a biological agent floating in the environment. And in certain cases the animals can also carry these viruses on their fur or on their back and then transmit that to the humans. So anyway it can be released into the environment. Now there is a documentation of the use of biological weapons during the French and the Indian War in North America between 1754 and 1767. Also human pathogens like Bacillus anthracis, botulinum toxin, Francisella tularensis which causes the tularemia which is transmitted through the rabbits, crop pathogens like rice blast, rye stem rust, these were all developed into the bioweapons. So what are the bioagent indicators? As I told you, we can't feel, see or smell them. Then how else can you sense that there is a biological agent which is dispersed into the environment or the nearby surrounding? So one thing is, many patients with the same illness are sick at the same time and they are going to the hospital at the same time. They are admitted for some same reason. Then the symptoms are unusual for the age and it may be attacking like people of all ages. Then dead animals before the humans. There could be a lot of dead animals in one area, dogs, cats, etc. And the type of infection is also rare to that region. Like in that region, for example, if it is Spain or if it is Italy or it is a pure pristine environment and there is no case of such biological agent before, then how did this arise suddenly? So that actually puts the minds and the forces into some working. Now the bioagent response, the first thing that when you have identified that there is something wrong, then you need to identify the bioagent, you need to see the source, the area that is affected, the geographical area, how many kilometers, hectares or the area that is affected, the population also exposed in that entire area. Then you need to notify the local medical facilities and you need to make the provisions for admitting so many people and notifying the specific medical centers and hospitals which will take care and admit the people of that disease. Then isolate and contain the people in the affected areas and the population. Right now the world is facing this pandemic of the COVID-19 and you are seeing that the identification is being done, notification of the medical centers is being done, then isolation of the people are being done, and again we are treating the people with certain possible medicines. Earlier times there were also certain vaccines which were available. Then you need to decontaminate the affected areas and the population. Contact tracing is also being done, so that if one person has visited 4 others and if those 4 others visited another 8 others, so like that way you can contact trace and bring everybody under one roof, test them and then clear them of the doubts whether they are carrying the bioagent or whether they are carriers of the disease. Biological terrorism. So it is a deliberate introduction of a biological hazard in a region with the intention of causing harm mass scale to damage crops, animals and cause epidemics and pandemics in the human beings. So we must treat the biological hazards with extraordinary caution, and it is a kind of violence or intimidation that is caused by organisms. For example, let me tell you, the biological agents can be carried even by people from one continent to another place. So if people are traveling on flights, on trains, on buses, They can also be carrying the virus within them, and when they are going to another area by sneezing or by coughing or by touching each other, the germs can be transmitted to another place, into another pristine environment and area. The biological warfare or bioterrorism may also be defined as the intentional use of any microorganism, virus, infectious substance or biological product that may be engineered as a result of biotechnology or any naturally occurring or bioengineered component of any such microorganism, virus or biological product or infectious substance to cause death, disease or other biological malfunction in a human, an animal, a plant or another living organism in order to influence the conduct of government or to intimidate or coerce a civilian population. So, this is the definition that has been given. Thus, bioterrorism is posed to be the next possible threat the civilized world faces and we are facing presently. It also differs from other forms of terrorism because biological agents are relatively easy and inexpensive to obtain. They can be easily disseminated into the air and they cause widespread fear and panic beyond the actual physical damage that they can cause. Use of genetic engineering to develop biological weapons. This is also becoming a new option that also holds a dangerous option. The ease of production and the broad availability of the biological agents from any preserved lab of known origin, and the technical know-how of how to spread them. Maybe scientists are also involved in this with the government agencies when they plan such attacks. So, for the spread of these biological weapons, and there is an increased desire among the developing countries to even have such biological agents for their own safety, for protecting themselves. Let us now see some examples which have occurred in the past. In a 1333 attempt to infect besieged city dwellers, the Mongol attackers in Ukraine, they used catapults to hurl the bodies of bubonic plague victims over the city walls of Kaffa. Tunisian forces used the plague tainted clothing as a weapon in 1785 siege of La Calle. The Japanese used plague as a biological weapon during the Sino-Japanese War in the late 1930s and 1940s. And they filled bombs with the plague infected fleas and dropped them from the airplanes onto 2 Chinese cities. They also used cholera and shigella as weapons in other attacks. An estimated 5,80,000 Chinese people, they died as a result of the Japanese bioweapon program. So far biological weapons have been used to create mass panic only, but it may pose dangers in the years to come. We must realize that the threat of bioterrorism is real and significant and it is beyond the boundaries of our country. Therefore, it is necessary to evaluate the historical account of the development and also the use of certain biological agents. So, what are the sources of the bioweapons? Any human, plant, animal pathogen can be used and can cause an epidemic, and that can be used as a bioweapon. The deliberate intention and action to cause harm defines a biological attack. Some examples are the anthrax, smallpox, plague, tularemia, brucellosis and botulism toxin. These are all considered as causative agents and leaders in the bioweapons. In this regard, we need to develop a system to prioritize the biological agents according to their risk to national security. So, basically there are 3 kinds of agents and they are classified on the basis of the extent of damage that they cause. They are classified as category A, B and C agents. The category A agents, they are the highest priority, and these agents are those agents that pose a risk to national security because they can be transmitted from person to person and result in high mortality, and they can have high potential to cause social disruption. Now, these are the anthrax, botulism, plague, smallpox and so on. The category B agents are moderately easy to disseminate and they result in low mortality. These include the brucellosis, glanders, then Q fever, typhus fever and also other agents. The last one, that is a category C agent. This includes the emerging disease agents that could be engineered for mass dissemination in the future, and that includes the Nipah virus. Now, there had been several sporadic incidents of the bioterrorism in the past, but the October 2001 use of the anthrax letters, that was received in United States, that was one incident that killed 5 people, and it also triggered a worldwide alarm that the bioterrorism and bioweapons are in place, and they can cause harm and mass destruction to people. So, people became aware. So, the government must form strategies to fight against the bioterrorism. Some preventive measures that can be taken up include prevention of an attack, detecting the bioweapon, availability of drugs and medicines, spread of awareness among the general public, and providing quick relief in case of an attack. The use of proper vaccines is also necessary to protect lives and limit disease spread in any case of emergency. Licensed vaccines are currently available for some threat like anthrax and smallpox, and the research is underway to develop and produce vaccines for further threat such as you have tularemia or the Ebola virus. So, many disease threat they lack a corresponding vaccine, but for those that have significant challenges exist to their successful use in an emergency situation. So, thus vaccines can handle the situation in a place, and it makes a strong public health system and it is a precondition to effectively handle these threats. Now, for this the various components of the public health system like surveillance, then assessment, medical management, information and education, all these need to be made stronger and efficient. So, are there some interventions? The response to an emerging infectious agent or disease necessitates coordinated efforts by various individuals, organizations and industries. For example, that can include the vaccine development, vector control, continued research and education of the public. The methods of dissemination of a biological agent, that includes aerosols, when they can be dispersed into the air forming a fine mist and nobody can even notice it, and that will drift even for miles together. Inhaling the agent may also cause the epidemic diseases. Animals. So, some diseases can be spread by animals. So, the animals can be smeared with these infectious agents and they can be let to fly in an area, and fleas, mice also they can be infected and then spread to an area. Mosquitoes and also livestock can spread the same. Prevention and mitigation measures that we can all follow. The general population need to be educated of such threats. What to do in such case of threat? Consuming cooked food, chlorinated and filtered water is always good for health. And insect and rodent control measures. So, you can call the specific concerned people for cleaning, a complete cleaning of the house in between, maybe once quarterly, half yearly or even annually. And every day, on an everyday basis, you can clean it yourself using good disinfectants and the antibacterial and antiviral solutions. The clinical isolation of the suspected cases are also important. In your own homes or in your neighboring surroundings, the isolation of the person is important so that he does not spread the infection to others within the family or even in the community. Early accurate diagnosis, that forms an important part. When anything is diagnosed at the right time, then the right kind of intervention and medicines can be given for the treatment of the patient. Mass immunization programs. For example, in the polio virus, there was a mass immunization. Same way smallpox. As soon as the child was born, it was given smallpox, BCG. Okay, this is also the vaccine for the tuberculosis. So, as the children are born, they are given the tuberculosis vaccine so that they are prevented from this disease. So, these are certain mass immunization program where the entire public and the community, the nation as a whole can be prevented from the spread of such infections. Finally, enhancing the knowledge and skills of the clinicians. So, for example, in our country we have the ASHA workers, we have the Anganwadi workers, you have nurses, you have the hospital attendants and the technical assistants, you have doctors, you have the specialized doctors in the various treating the various organs. So, they can all enhance their knowledge and skills, learning the latest art and the updates in their field, and thereby they will be able to treat the patients and manage the patients better. So, dear learners, in this module we have learnt about the biowarfare and the bioterrorism. We have seen the sources, the agents that can be classified as category A, B and C, and how these agents can disperse the biological agents through vectors or through aerial dispersion mechanisms. And the biological agents, unfortunately, it takes time for it to be noticed. Sometimes it takes days, it takes weeks, for it for a place to be declared as a biological hazard or a biological terror attacked area. And first we may notice some dead animals in an area, and also a number of people getting infected with similar kind of infections, and then you need to go about the treatment of the same. Now, in many cases the biological agents, they can arise from the laboratories, and people may use it in the mass scale for certain immediate gains, and this has occurred in the past where we discussed some case studies, where the epidemics and pandemics have occurred and where they have wiped out millions of the population. So thereby the general population needs to be educated and needs to be aware of such threats that can occur in future, and they need to be prevented and well protected with certain measures, and mass immunization programs and early diagnosis can also help in the prevention of the same. I hope you have understood this module. Thank you for your patient listening.